Just give things a few moments to allow registrants to enter. Just want to say welcome to everyone as people are coming in one by one. We'll just get started in about 20 seconds or so. All right, we'll get started. Welcome to everyone. My name is the Association, and I want to welcome you all again. Thank you so much for your flexibility as we approach the holiday season. I understand flu, COVID, and lots of things are happening in the pharmacy space today. So I appreciate the time and the commitment to this very important and exciting webinar. I would be remiss if I didn't mention that our OPA membership is now open for 2022. So if you have not yet purchased your membership, now is a great time. So not exiting the webinar, but perhaps right after you take a moment and sign up for membership for 2022. The future of diabetes care in Canada is part of our signature learning series, the 100 Years of Insulin, and it's sponsored and brought to you by BD and Essentia Diabetes Care. When we started planning for this series last year around this time, we saw a perfect opportunity to commemorate such an important milestone in Canadian history, the discovery of insulin. If you haven't already, please visit our webpage. We created a beautiful dedicated space which has previous webinars, podcasts, and other exciting content we have put together. And we did that in partnership again with BD and Essentia Diabetes Care. So I'll take a moment to maybe ask Ruth if you can take a snapshot or click that, put that link inside of the chat so it's available for you to visit after the webinar. So you all as pharmacy professionals play a key role in the achievement of optimal health outcomes. And these valuable programs and resources can be applied to your practice when caring for patients living with diabetes. As we continue to see the lanes of healthcare converging together, your role will continue to be integral to the future of diabetes in Canada. So I will take a moment now to introduce Jennifer Spearing, the Vice President of Diabetes Care of BD, and Annika Pawaru, who's the country head for Essentia Diabetes Care. Jennifer?
Hi, everyone. And Liliette, thanks so much for having us here. As Liliette mentioned, my name is Jen Spearing, and I am the Vice President of Diabetes Care at BD. BD has been proud to support people with diabetes since 1924, when we actually manufactured the first insulin syringe that was available on the market. So very closely tied to really the discovery of insulin 100 years ago now. This year, we're particularly honored to be part of the collective celebration to commemorate the 100th year anniversary of the discovery of insulin. And our ongoing commitment at BD is to continue to deliver solutions that minimize the burden and complications associated with diabetes for the nearly 11.5 million Canadians affected by diabetes and those who care for them. We at BD Diabetes Care are currently hosting a global campaign that will span several months, which recognizes the 100th anniversary of the discovery of insulin and demonstrates our longstanding role in insulin delivery, as well as the company's ongoing support of the diabetes community, both today and in the future, through a social giving campaign that will match donations up to $100,000 for Life for a Child and Direct Relief. We are also supporting JDRF by providing a $100,000 grant for the development of a mental health pillar, which will engage and train over 1,000 healthcare professionals to support patients with diabetes in their mental health and wellness. I have always felt that mental health is one of the most misunderstood and overlooked complications of diabetes, and I'm thrilled to be part of a new focus in this area. The partnership that we at BD have had with OPA and the 100 Years of Insulin has given great exposure to the pharmacy community of this important milestone, highlighting the evolving role of the pharmacist in diabetes management. The pharmacist role is expanding, and it's important that pharmacists continue to support people with diabetes. As a person who has type 1 diabetes, pharmacy has always been an important part of my healthcare team, and through COVID has taken on an even more important role as the most consistent and accessible healthcare professional for me over the last 20 months. In particular, my pharmacy tech at my local pharmacy is a key partner in my care and has better visibility to my overall healthcare needs for both me and my family really than anyone else. And I'm very thankful for the care and support I receive there. In early 2022, BD will be spinning off our diabetes care business into a pure play diabetes company, which will allow us to invest and focus even further on our ongoing commitment to those living with diabetes. The new name has just been released this week, and Embecta will be the company's new name. The name Embecta embodies the BD spirit by embedding part of our legacy BD brand name, the Becht from Becton Dickinson, in the name, while the prefix, the EM on Embecta, also invokes empathy for people living with diabetes and the empowerment of this new company and its global team to seek new avenues of growth. You can learn more at www.embecta.com, but it's important to note that we'll remain part of BD until the spring of 2022, so changes are minimal until that time. But please stay tuned to learn more as we look forward to continuing to work with this pharmacy group as BD and as we transition into Embecta. So with that, I'll pass it back to Liliette. Thanks so much.
And Annika, I'd love for you to say a few words about Essentia Diabetes Care, please.
Perfect. Thanks so much, Olivette, as well as Jen, and thanks for having us here. My name is Annika Pawaru. I'm the country head for Essentia Diabetes Care Canada. We're really delighted to actually commemorate the 100th year of the discovery of insulin in partnership with the OPA and the pharmacy community. Established in 2016 through the acquisition of Bayer Diabetes Care by PHC Holdings, Essentia is a global company dedicated to improving the health and lives of people with diabetes. And we're also home to the Contour portfolio of blood glucose monitoring systems. We also have a proud history in the category, actually having developed the first portable blood glucose meter known as the Ames reflectance meter back in 1969, if you can believe it. So times have certainly changed since then. We've had a real history of being in the category with over 70 years in this particular category and having lots of firsts, and including the introduction of no coding technology, but also our most recent line, which is the Essentia Contour Next One blood glucose system, which features our Smart Light feature, which helps to enable easier understanding of blood glucose readings via a traffic light system to show if the readings are in range or high or low. And this meter also connects with our Contour Diabetes app. And today we're really proud to partner not only with groups like the OPA, but also a number of advocacy organizations, including Diabetes Canada, JDRF, and the Diabetes Hope Foundation. I think in parallel, Essentia Diabetes Care has also recognized the important role of pharmacy in patient care as a vital part of the diabetes care team, providing support on self-management, medication management, and coping with the chronic nature of the disease, to name a few. Our primary area of focus is the pharmacy space, and we work with a number of key stakeholders in pharmacies nationally across the country to provide a suite of educational tools, resources, and programs to help meet the needs of pharmacy and people living with diabetes. I think one of the reasons why we've been so successful is truly because of the trust that we've built over time with the pharmacy community and working very closely with a vested interest to ensure that we're meeting the needs of people living with the diabetes, but also the valuable relationships and strong collaboration that we've had with our pharmacy customers. It's truly phenomenal to see all the advancements that have been made in diabetes since the discovery of insulin, transforming the lives of millions of people living with diabetes. And although I won't be here in 100 years, and perhaps neither will you, but we very much look forward to the years ahead, really, and what's to come in the treatment and advancement of care for people with diabetes. So I just wanted to thank you for the opportunity to be a part of this exciting milestone, and really look forward to continue our partnership with the OPA and the pharmacy community to continue to bring more resources for pharmacy professionals to help in the delivery of care for people living with diabetes. So thank you again. I appreciate it. And I will pass it back to Liliette.
Thank you both. I think I'm excited, Essentia, many more great things to happen. And Jennifer, exciting the spinoff and a new company sort of being born to continue on some great things that BD has done. So looking forward to that as well. Thank you again to both of you for sponsoring and for being here this evening. So without further ado, let's jump right into our exciting webinar. I'll take a moment to introduce Siva, who practices as a community pharmacist in the town of Beamsville, Ontario. Initially an international pharmacy graduate from the University of London, Siva became a pharmacist in Canada in 2011. And in 2013, he decided to further his education by becoming a certified diabetes educator. So thank you and welcome, Siva. Fabio is a pharmacist owner, certified diabetes educator, and University of Toronto PharmD preceptor. He also is a lecturer in OPA's Comprehensive Diabetes Education Prep course, thank you, and a clinical instructor at both Universities of Toronto and Waterloo. So welcome to you both, and let's just get started.
Thank you.
So first question is to both of you. What sparked your interest in diabetes care, and how did you both begin working with patients with diabetes?
Hey, thank you so much, Lydia, for the kind introduction and all the hard work that you guys do at OPA to help support the profession. It's great to be here with Fabio, who I really look up to as a peer and as a practitioner. So to answer your question, my interest in diabetes care really came about when I first started working in community pharmacy in Canada. I was still relatively new, just 2 years out of university, and my preceptor left me to counsel the patient on a basal insulin start for the first time. And you know what? I wasn't the best. I basically had to read the patient information leaflet out verbatim, which probably didn't instill the greatest confidence in that patient. So my preceptor supported me by enrolling me in, at the time, was the OPA Level 1 Diabetes Education Program. And that really improved my skills and confidence in a long way. Then I practiced for 2 years post-licensing and decided to pursue the diabetes educator certification. And honestly, I only pursued it to gain that extra credential and what I thought it would improve my diabetes care skills just modestly. But I was really wrong. It totally changed my practice. And because I'm a designated manager in my practice site, I had the relative autonomy to apply these skills into practice with my vision. And you know what, I really love community pharmacy. A lot of the peers on the call know that. And my love grew even further as I was able to play a much bigger role in the care of my diabetes patients. And yeah, Fab does, and his colleagues do a great job in that OPA prep course. I've done it twice now, initially when I certified and then when I renewed. And you know what, it really does give you structure in what you need to know. So thank you, Fab.
Amazing. Fabio?
So I'd like to say that I'm quite honored to be part of this memorable moment here, 100 years of insulin. I like to echo what Siva said. I know for a fact the impact that Siva has with his patients and his community. So I don't look too close to him, but I hear all the great things that he does. So I can second everything, all the passion that he has for the profession. For me, to be honest, I never really dreamed that I would become a pharmacist in my younger years. My goal was to become a teacher. It just happened that I went into pharmacy because that's what my friends were doing, and that's what I did. But I always still had a passion to teach, and that's why I became a CDE. I found the CDE allows me to really focus in on the teaching aspect with my patients and education. And a little bit more personal reason, both my parents are diagnosed as diabetics, and being a pharmacist, I wanted to make sure that I was, paramount in their journey through their disease, and make sure that they're doing the best that they can to mitigate their issues.
Wow, so interesting. So that you said, Fabio, you wanted to go in one direction and the other. I wanted to be a meteorologist, so I'm not a meteorologist clearly, but on a serious note, I think we often enter into training courses or certifications thinking there'll be a modest improvement, like you said, in knowledge, Siva, and then to hear for both of you that it was transformative. That's great. That's amazing. So let's just do a poll quickly. In the last month, so this poll is going out to all of you who are listening in on the webinar. So I think Ruth's going to cue it up. In the last month, how many pharmacists or pharmacy professionals on this call or webinar are nearing the feeling of burnout at work? And this will be a nice segue into the next question. So again, in the last month, how many of you are nearing the feeling of burnout at work? We'll just take a few minutes. We're seeing the numbers coming in. Overwhelmingly on one side. I'm sure you can predict where that's going. And I think Ruth. Good. So I think we've published that now, and we'll share that. So any thoughts there? Let's go into the second question as we sort of look at the ever-growing prevalence of diabetes and how COVID-19 vaccines and flu shots. How are you balancing all of this? You're providing and making sure that you're providing the appropriate care for patients with diabetes. So jumping off of the results, maybe Fabio, you can start and sort of talk about what we're seeing here in the polls and sort of how you're managing through your practice.
I believe that the stress and the concern that you see here in this poll with these results is very real. What's being asked the pharmacy today is more than it has ever been asked the pharmacy. You know, as access to healthcare has been diminishing for our patients through this pandemic, pharmacies never closed their doors. We stayed open. My store is 24 hours, so we actually literally never closed our doors. So patients needed somewhere to go and speak to, just, you know, to help calm their anxiety, just for questions. They had nowhere to turn. So they would come and say, you know what, should I be getting the vaccine? Should my children be getting the vaccine? What about the flu shots? What about my doctor's not, office isn't open right now, but what do I do about my medications? I have this issue. So we had to take all that and you know, that stress is very real to our teams. On the flip side, that means that our accessibility for our patients was paramount. So the fact that we have this accessibility also gives us the responsibility and the obligation to make sure that we are making a difference in our patients' lives, because that's who they're coming to look to. So what we do at my location is we have something called life-changing moments, and what we ask every pharmacist to do is to pick a passion that they have, whether it be nutrition, whether it be geriatrics, whether it be asthma, whether it be diabetes. Mine was diabetes. So you pick a passion, and in that, we ask you to make a life-changing moment once a day with a particular patient. So if that's your passion, that's what you want to focus on, and make sure that you have patients that come to you and then they come back to you. So in 3 months, reschedule with them and have them come back to you, so you can continue that dialogue and that line of communication. So yes, it's very challenging these days for everything that's being asked of us. But I like to say, if we look at it and say, we just pick one person a day and have a life-changing moment with that person, you know, that how cool would that be to wake up in the morning and know that today I'm going to have an impact on Mr. Smith or Mrs. Smith, and to know that you have that capability, and that's why you go to work every morning. I think that's pretty cool.
Yeah. So focusing on your team, pick a passion. That's amazing. And I think inspiring that care one patient at a time is amazing. Siva, what are your thoughts?
I want to echo Fabio's sentiment, Lydia. You know, we have done so much, pharmacists, pharmacy technicians, pharmacy assistants, you know, even our delivery drivers. You know, when no one knew how deadly COVID was, we stuck to it and we just carried on, right? And those life-changing moments that Fabio talked about, that really stands out to me. And, you know, it's something I'm going to take back to my team, because like you said, Lydia, it is really inspirational. You know, recently, right? So that polling question is about the last month. So a lot of my patients and even my own family say, hey, how are you preparing for these upcoming boosters and this pediatric vaccination campaign? So there was always a short pause, a wry smile, and something bordering on a blank stare, because I don't know how to respond, right? So burnout is something that really has affected much of us. And I think, like Fabio kind of alluded to, I think we can all safely say that the majority of us have at least been overworked at so many times in the last 2 years. Not every community pharmacy, for example, has a pharmacy technician, but I think they really are one of the backbones of both hospital and community practice. So can you imagine what community pharmacy might have looked like if scope wasn't expanded to accommodate pharmacy technicians doing COVID vaccines? I know not every community pharmacy has one, but it would look very different. So utilizing pharmacy technicians as key players in immunization services, I think that's really helped me to continue to provide the diabetes education services through the MedCheck program. I think the virtual-based method of care advocated by OPA has allowed us to maintain a certain level of care. And I would even go as far as to say that we wouldn't be able to deliver these services, and those gaps in care would have been severely exacerbated during the pandemic if we didn't have those virtual methods of delivery. It's allowed a certain amount of adaptability to pivot, and also being reimbursed for following up with a patient maybe 2 or 3 times a week that's getting frequent hypos, follow up with a patient in a timely manner that might have to reduce their insulin dose, for example, because they've just started an SGLT2 inhibitor. So over and above leveraging those virtual medication reviews, I think promoting and expanding appointment-based delivery of diabetes education services is something that has allowed the pharmacy colleagues that I work with to keep trying to provide that same appropriate level of care, right? So listen, I know appointment-based models aren't for everyone, and I mean everyone in terms of patients. And I know we've had to adapt a lot to the patient in front of us, but it does work very well for a critical mass. And I think pharmacy professionals need to promote and make this provision a mainstay of practice. We often just don't have the resources to manage walk-in everything, right? So that's how I would sort of answer that question.
Yeah, definitely. You know, I think it's definitely looked different in the last 2 years, how pharmacy is practiced and what it looks like every day going forward, or sorry, what it's going to look like going forward every day. But I'll take a minute just to thank you both for continuing to be open and continuing to do all you can in the communities as we sort of get through this pandemic. And for those of you on the call as well, all the professionals, pharmacy professionals here, thank you for continuing to remain accessible and open. So let's jump into one more poll. So going to open up the poll lines again. We'll talk about vaccine hesitancy, and that sort of segues into our next discussion around diabetes. Vaccine hesitancy in Black communities is merely because of misinformation or gaps in health literacy. Yes or no? So it's a yes or no question. Vaccine hesitancy in Black communities is merely because of misinformation or gaps in health literacy. Yes or no?
I'm trying. Oh, there it is.
I think it's shown up now. There we go.
Shown up, yes.
Okay, coming in. Great, looks like it was even. Now it's moving in one direction. All right. A few more answers coming in.
Great participation, Amelia. Thank you so much to everyone for participating. It's really good.
Excellent, good. Yes, I think we can close that poll in a few seconds. And I think we just published the results. Okay, interesting. 64% no, 36% yes. So according to Diabetes Canada, people from communities of color across Canada are at a higher risk for diabetes. The incidence rate of type 2 diabetes is double in the Black communities and triple in South Asian and First Nation communities compared to white Canadians. With more conversations centering around diversity, equity, and inclusion, and I think that's been whether in healthcare or right across many industries, going forward, how do you think pharmacy professionals can apply insights such as those from Diabetes Canada to improve more individualized approaches to assisting patients with diabetes? Maybe we'll start with you, Siva. When you sort of look at this poll and the
Mhm.
responses. What are your thoughts on that?
Yeah, it's like a hodgepodge of different thoughts. Diabetes Canada, certainly, they have so many good resources that talk to health inequities amongst minorities. This poll, I think there's, it's a kind of yes and a no question, right? Because health literacy and misinformation play a part, but I think that's part of a bigger picture. So pharmacy professionals like pharmacists and pharmacy technicians, and even lay staff, they can play a really, really big role in overcoming some of these inequities that studies have shown to exist in Black and other minority groups as well. So in my community pharmacy practice, I do serve visible minorities. I wanted to first talk about Indigenous communities, for example. So as pharmacy professionals, we know so much already that should really change our way of thinking. Indigenous patients are at a real risk of diabetes and its complications, and that risk is so much higher, like you said, Lydia. I didn't know it was 3 times. That's just such a thought-provoking prevalence of diabetes. So particular attention should be paid when patients get their diagnosis, or even when they get their first prescription for metformin or a blood glucose monitor. So in my practice site, when I verify those prescriptions that come through, I try and call the patient to see what time might be an appropriate time to give appointment-based care. That being said, and I kind of alluded to this before as well, the opportunity to make important interventions in community pharmacy often comes impromptu, right? So we have to adapt our workflow to accommodate that ability to provide that really key piece of information effectively. And I think it's important that as pharmacy professionals, we do as much as we can, and that as designated managers like me and Fabio, we give our staff pharmacists and pharmacy technician colleagues as much time and labor resources we feasibly can. And I think time is a leading factor in our ability to respond to ethnocultural as well as social determinants of health. And got a couple of examples to share, Lydia, but I don't know if I should give way to Fabio before I give those examples.
Yeah, well, maybe we'll hear from Fabio, and then I'd love to hear some of your examples, Siva, for sure.
So, speaking of inequities and lack of accessibility for various patients, it just hammers home the importance of pharmacy, because our accessibility is there, and we have to make sure that we do have the accessibility for everyone. We're talking about personalized care. I mean, that's where healthcare is moving towards. It's moving towards a more simple, affordable, and personalized care model. I'll give you an example of when I first graduated. When I first graduated, I really thought, I had all the information I needed. I thought I was a superstar. I thought I was going to go and change the world. And, from day one, I thought, I can't wait to see my first patient. I'm going to go and I'm going to literally change the world. And I came across this one couple, and we'll call him Mr. and Mrs. Farina for now. And the husband had diabetes, but it was the wife that actually was very concerned. And she came to me and she wanted help with his diabetes and what's going to happen now. He's just diagnosed. And I said, perfect. And my parents were diabetic, so I knew that I was really brushed up on diabetes. I said, here's my chance. I'm going to change the world, starting with this couple right here. So I go and I spent about 15, 20 minutes with them, and I go into the spiel, and we go back and forth. But by the end, I really realized that my message wasn't really getting across. And the couple ended up leaving, and I don't really think I made that impact that I wanted. So I come back very down on myself and disappointed. I walk back into the pharmacy, and one of my colleagues says, "What's wrong? You don't look too happy." I said, I had this couple here. I had my chance. They had diabetic. I thought I was going to, make that connection and make that, make that difference and change the world. And he said, "Well, what were their names?" I said, "I don't know. I don't remember their names, but this was the situation." He says, No. Let's start here. What were their names? I said, I don't know their names. He goes, "Well, that's where you need to start." And that's when I realized that healthcare has to be personalized. It doesn't matter if you have the best information in the world, if you know how to cure something, or if you know how to make a difference in someone's life. If you don't make that connection or that relationship with that patient first, if you don't personalize it, none of that information matters. It doesn't matter how good of a pharmacist you are. It doesn't matter what you have to offer. So I realized that in all aspects of what we do, we have to make sure that we are personalizing it, and everyone is different and every culture is different. And we have to make sure that we pay attention to that as we're helping customers, our patients.
Yeah, I would definitely agree. And I think that was, key in what you said. Personalization would include culture and rituals and different things that would come into making the individual who they are, how they eat. The patterns and simple things that govern their lives could affect as well. So I think that's key. Certainly at the OPA, we've been talking about next year bringing a number of different webinars that would focus, or learning that would focus around racialized communities, access, people of color and Indigenous. So more of that's coming as we realize that need to be more personalized in how we manage patient care is important. And so we'll be providing some of that education. So if you had some examples that you wanted to share, maybe you can share a couple of those with us as well.
Definitely, yeah. And I wanted to just thank you, Lydia, for bringing that forward at OPA. I think it's important that you do that, but what's incredibly more important is that the peers on the call encourage uptake of this kind of education, because it might not seem as important as other stuff, but it is incredibly important. And I agree with Fabio wholeheartedly. Knowing your patient's name and making it far less transactional is so important to their care. The first example is an Indigenous patient that I have, and I established a relationship when they first came to the pharmacy, and I affirmed that relationship with each regular encounter I had, as a community pharmacist does, right, at regular pickup. And I was helping them, and I think I helped adherence to his drug therapy, albeit slightly with those minimal interactions that we had. And then I didn't see him for the longest time, and then I just went on Clinical Connect and I saw that he'd been admitted for HHS, hyperglycemic hyposmolar syndrome. And you know what, I called him when I knew he was being discharged, because there was a discharge summary on there, and he didn't pick up for the longest time. And then he came in one day, and just luckily I was working that Sunday, and I was saying, what happened? How come your sugars were so out of whack? I thought you were doing all right. He wasn't that adherent to it, and maybe I was passive. Maybe I should have put him on a blister pack sooner. But we got him set up on a blister pack, and his sugars normalized, and he's in a much better spot now. But I think I identified in that there is mistrust, right, in particular communities, and whatever we can do, especially following Fabio's examples of establishing that trust, making it less transactional, is important. And then there's another example, actually. This is a really good example of another visible minority. So I had a patient from an African background that was diagnosed with gestational diabetes, and my pharmacist colleague on the Friday night counseled her quite thoroughly, actually, on insulin use. And a standard of practice in my practice site is that, any new diabetic, try and book them in for an appointment with a CDE, which is me. So I came in Sunday for my shift, and the person stuck to the appointment, and I use that diabetes MedShake template like I do for all my patients, just so I can provide the same standard of care for everyone. Mm-hmm. And when it came to reviewing dose administration, I always try and take a dose together with a patient of insulin or whatever. We're doing that prandial dose together. And I discovered for the 2 days since that Friday night when the first pharmacist spoke to them, I'm going to ask Lydia, because you're not a pharmacist, right? And I want you to just guess where she was injecting it in her body.
Okay, put me on the spot. I'm going to say her lower abdomen, but maybe off to the side.
That's what you would think, right?
Mm-hmm.
She was injecting it into her deltoid.
Oh.
Yeah. So culturally, injecting into the abdomen wasn't appropriate for her. And that's because she thought it would pose a risk to her or her unborn child. And she followed the alternate site of injection. The pharmacist did say, there are other options or whatever. And obviously it's in the fat, it's not in the deltoid muscle, right? So I think the take home message is that, like you said about education, we all have to be really constant. We have to be persistent in learning from each other as peers in our practices, in sharing important reflections and experiences related to social determinants of health that we come across. So I think at a pharmacy level, if we have the time and resources, we can partner with community groups. We can become more familiar with social norms. Only then will we upskill the profession as a whole to plan for and respond to the needs of minority groups, whether they're a minority due to sexuality, race, income level, or anything else we can think of. So I feel really strongly about that.
Thank you. Thanks for making that come alive with those examples as well. So we'll continue moving through because we're 7:35 already. The time goes quickly. So as a pharmacist, how do you collaborate internally with others within your pharmacy team, be that technicians or assistants, and then externally with other allied health practitioners, and specifically around diabetes care? Do you think there could be any improvements in the current tools used to communicate between various internal stakeholders and external? And maybe we'll start with you, Siva.
Definitely, yeah. I talked about pharmacy technicians before, right?
Mhm.
In community pharmacy, we aren't always lucky to work with the pharmacy technician because they often practice in hospital pharmacy. But if there were more pharmacy technicians around and more working in community pharmacy, I think that we could provide a lot of care more effectively. Particularly the demonstration and assistance with the utilization of devices under pharmacist supervision. A lot of this depends on scope, but I think there's an opportunity there. Pharmacy assistants too, in my practice site anyway, are critical to adherence to appointment-based models of care for diabetes education. Recently, I've held them accountable to identify 2 or 3 patients who are particularly vulnerable that would benefit from the services. Because they're really well placed to identify these patients. This is what I believe anyway. And I think the relationship with our physician colleagues is super important to our patients. We've seen it all the time, conflict between a pharmacy team and a physician or nurse practitioner's office. Who ultimately loses here is the patient. So building relationships, which takes time, is really important. And physician, nurse practitioner colleagues respect our professional opinion more than we like to acknowledge. What I've found in my practice is that ending my letter with diabetes educator stroke pharmacist as opposed to pharmacist increases the likelihood of them responding to my recommendations and the direction I'm giving. And like Fabio said before as well, having that CDE designation, make use of it if you have it, because it does make a really, really big difference.
And from your viewpoint, Fabio, maybe you can talk a little bit about the relationships inside of your pharmacy and again with your allied health partners.
So a ways back, I attended a little session at a diabetes education center. I was at the hospital. And at the end of it, I went to them and I asked them, what do they see as the biggest barrier to patient health? Like if they had a magic wand, what would they do differently? Because I saw so many great things happening there. And they said that their biggest issue is that patients come there once when they're first diagnosed and then they don't come back. So the problem there is when they go out into the community, they see their doctor, they see their endocrinologist, and they see their pharmacist, and they hear different messages than what was first told to them by the Diabetes Education Center. So at that point, I asked them, okay, so what is it that you guys teach at the Diabetes Education Center? Do you guys have a program? Do you have and they did. So I took that program and I said, okay, we'll mirror it at our location, and then we'll make sure that after a year goes by, we'll send them back to the Diabetes Education Center so that they go back. And this way they can continue hearing the same message from us, and they're going back to the Diabetes Education Center where they're going to continue to get follow-up. I do think that the biggest gap of patient care right now is the connection between the pharmacist and then the endocrinologist and the physician. I do believe that there is a gap there that we do need to close. And I think one way to close that is when pharmacists attend CEs and that, I think we should be attending them with physicians or with endocrinologists. We should be all at the same venue. The goal is the same, the disease is the same, the outcome should be the same. So we should all be incorporating ourselves in there together. Internally, like Siva said, utilizing your team is the most effective. We do underutilize our assistants or technicians for those who have it. They do see every single patient. As a pharmacist, we don't. The technicians or the assistants do. And they do most of the screening. They have the ability to do most of that screening. And I think what Siva does is outstanding, because I think that's where our biggest opportunities is to capture patients that get missed.
That's interesting. So I liked hearing about that joint CE opportunity, because that is something, Ruth has been talking to me about some opportunities from a mental health and substance use disorder perspective, but just bringing the profession together as well, along with healthcare practitioners to kind of manage some of these patients is something that she's got a vision to do. So that would be interesting. I think that's a great idea as well, that joint CE, bringing all healthcare providers together. So yeah, great. Thanks for bringing that up. That's awesome. I think we're heading in the right direction there, Ruth. What are some of the lesser known symptoms of diabetes as a healthcare provider? And how do you educate patients to make them aware of these risk factors? So we all know sort of the bigger symptoms, but these lesser known ones might be an area of opportunity. So Fabio, can you share a little bit about that from your perspective?
Sure. I had a patient one time that came to me, and they really came because they were feeling very fatigued, and they wanted more insight into why. What can they do? Can they change their nutrition? Is it sleep? Is it their medications? What can they do to improve their fact that they're always tired? So as I sat down with them, I started asking questions, and they also told me that they were getting recently they had a lot of cavities. They never had cavities before, but all of a sudden they were getting these cavities. So at that point, I said, you know what, just for the fun of it, let me just try taking A1C with them. And sure enough, that person was diabetic. So it's not always someone that comes to you that tells you, that has the symptoms, had a blood test, and that's how they found out they're diabetic, or they're urinating a lot, or they have a family history. Sometimes it's these obscure patients that, otherwise seem healthy and don't get screened by the pharmacy, don't get screened by the doctors. I think so we have an opportunity there. So now that we have these point of care tests available inside the store, we try, and as people are waiting for their prescriptions, we try and screen them for A1C, for cholesterol, for AFib. We just screen them just to see, because you never know. And while they're waiting, these are the people that would be missed because they're not of the age that they would get screened. They don't seem unhealthy. So as a pharmacy, with the accessibility that we have, right, people visit pharmacists more than any other healthcare professional. I think we can have an opportunity there to screen. If we utilize our technicians and assistants like Siva says to help capture these patients, we can actually screen people right at the store. And you won't catch a lot, but if you catch 10%, that's 10% that would have been missed.
Yeah, what a great best practice, that point of care testing. Siva.
Yeah, you know what, that was really thought provoking. So in my practice, two things I would probably highlight is sexual dysfunction, and it's not necessarily related to diagnosed or undiagnosed diabetes in our patients, and that it should be, right. Some studies I think show that up to 40% of men with type 2 diabetes have a form of hypogonadism. So depending on what you read, so sexual dysfunction might be a symptom of undiagnosed diabetes that's progressed. And it could also mean that one of our patients may benefit who may have diabetes to get their testosterone levels checked, because testosterone is more than just a sex hormone, right? It affects your energy. Obviously, it affects your sexual function too, but I think it's something that we don't often put together, and it's something that I think we should try and be cognizant of. And in the same sort of light as what Fabio said about screening, frequent vaginal thrush is also something that I've seen in a lot of our female patients. We see self-treatment with over-the-counter products, right? And all this self-treatment, it could be undiagnosed diabetes, right? Unrealized. And I honestly feel that sometimes seeing clotrimazole and fluconazole products, sometimes I think they should be scheduled too and require pharmacist counseling. I'm not saying it absolutely should be, but because that could reduce access, right? But it's something that regulators should consider, because a lot of our female patients just keep buying it and not necessarily know that they may have diabetes.
Fair. And I think even, Jennifer from BD talked about the depression side of diabetes. And have you seen a lot of that in your practice, Siva, when you're working with patients with diabetes?
Absolutely. And a lot of it relates to low testosterone, particularly in male patients, but obviously you can see it in female too. That's one of the consequences of hypogonadism. And especially during the pandemic, I think it's definitely been exacerbated. And I think, kind of alluding to what Fabio said, it's really important as pharmacists, we direct them to where to access that kind of care, namely their family physician, to help them get help, right?
Fair enough. Yeah. What are your future predictions on how pharmacists will be involved with helping to treat and manage diabetes? Maybe we'll start with you, Fabio.
Well, I mean, if the pandemic has definitely shown what pharmacies can do. I said it before, the future of pharmacy, the future of healthcare is, has to be simple, affordable, and personalized. So if you look at what pharmacies done over this time during the pandemic, the accessibility has definitely been there. I mean, I had a patient that came one time walking through the store, and they're on their cell phone, and they saw me and they said, "Here, take the phone." I didn't even know what the patient was doing, but handed me the phone. I answered the phone, and on the line was their doctor. And the doctor said, "Can you please take the patient's blood pressure? I need to adjust their medications, but I need their blood pressure in order to do that." So he had asked us to take the blood pressure right there in the store because the patient didn't have access to the doctor's office. During this pandemic, patients were polled, and they said, how do you see pharmacy? How has the relationship between you and your pharmacist changed? And this is what a patient actually said. This was a direct quote. It said, "Pharmacy is the first door in our healthcare system. It's the most accessible, and it's the easiest to open." So that's where we are. That's where pharmacy has now been placed. I mean, 10 years ago or 15 years ago, prior to flu shots, pharmacists weren't even allowed to touch a patient. It wasn't in our scope to even touch a patient. The only healthcare profession in Ontario not to be able to touch a patient. Flu shot changed all that. Now we're being asked to do COVID vaccines. We're asked to do COVID testing, symptomatic testing, even on that front. And you look at Alberta, and then we look at minor ailments that are coming down the pipeline. Governments are coming to us now, asking us, can we do more because of our accessibility? We are the frontline healthcare professionals, and patients will come to us first. And we have to be there for them.
Yeah, I think that's very, very powerful what you're saying. And when I think about sort of the next question, and maybe I'll sort of blend it, because we talked about, the future predictions on how pharmacists will be involved, and with all kinds of technology now as well, pancreatic islet transplants, insulin pumps, softwares that recognize and adjust doses. And then we all have these smartphones and applications. And there's so many examples of, implemented technologies and things that are connected. So maybe, Siva, when you talk about sort of the future predictions of how you're going to be involved, maybe you can talk a little bit about technology and applications that are being used as well, and maybe share that from your experience.
Oh yeah, no, I'd love to. Yeah, so Essentia has got the Contour Next, right? And they're one of the first companies to have an app to sort of store your readings and monitor them like that. And then now we've got flash glucose monitoring as well. And it's an important question you asked. Yeah, the vast majority of patients have smartphones that are NFC enabled. So in my practice site, the pharmacists I work with, we're really proactive in saying, you know what, download the app before you come in, so we can set up your flash sensor. And then a pharmacist or pharmacy technician setting this up for the first time really does help our patients implement technology with ease into their life. And that's the example I would draw. More recently, flash glucose monitoring has really dramatically improved my patients' hold on their diabetes, and really help them identify important patterns and triggers, food triggers that they might be able to avoid. So I think we need to upskill our knowledge of technology and just keep improving it, because it's only going to get more complicated.
Do you see a place where there will be, let's say, wearables, right? Because we know that's not going anywhere, and that technology is there already, all connected to a place where, we talked about the allied health practitioners and working together. So there could be a central place, hopefully one information system where all of these wearables and different data inputs are going, where you will have access to be able to see how things are going, whether that's on a daily basis with that patient, things like weight or blood pressure, to your point, Fabio. Do you see a place where that will be near or far in terms of your role there, and how far out do you think that is? To either of you.
Yeah, so personally, I think we're closer than we've ever been. I mean, prior to the pandemic, I wouldn't have said so, but the pandemic has skyrocketed our place in the healthcare system. So I think it's closer than we have ever believed it to be.
Siva, any thoughts on that?
Yeah, I agree with Fabio. It's closer than we think. Obviously, there's lots of regulatory things that sort of need to be overcome about, access to those records. But, with seeing how technology has evolved in just the last 2 years since, with the new Apple Watches, flash glucose monitoring, I can see that happening very soon, just like Fabio said. But how it comes about with privacy and all that kind of stuff, we'll have to see.
Yeah, that's the part there for sure. So last question, I just want to remind everyone as well, we will have some questions and an opportunity to go back and forth. And I see there is one here, but just one last question before we move into the Q&A portion. What are some of the tools or things related to diabetes treatment that new pharmacy practitioners and students have that you didn't have when you started practicing, right? So things have changed, not saying that it's been eons, but since you started, what's evolved? Fabio?
Okay, so yeah, sure. I see three things have changed since I graduated. One, the direction of the guidelines have changed. We are now more personalized in our guidelines. They used to be just treat diabetes, lower the person's blood sugar. Now, as you can see with the new guidelines, we're directing disease management with the SGLT2 inhibitors and so forth. So we're actually targeting the cardiovascular disease that comes with diabetes. Well, I see changes in the fact that we are being reimbursed as pharmacists for doing things like med checks and all sorts of things now that we were never being paid before. So we're being recognized in that way. And our relationship has changed with our patients. Patients have always looked to us with trust and as a key stakeholder. But today we've moved from an important member of their healthcare team to one that's life-saving. I mean, just look at the COVID vaccinations that we're doing for them. So I think all those three things have changed.
Wonderful. Siva?
Yeah, that point that Fabio made about relationships. So I really hope pharmacy students now appreciate that. We've always had a great relationship. We've always been one of the most trusted healthcare professionals, but it really has affirmed so much over the last few years. And I think it's something that as a profession we should all be proud of. So Fabio, remember when we first qualified as pharmacists, right? We didn't have a clue what anyone's A1C was.
No.
It was such a dark space, right?
Yeah.
As a pharmacist, particularly pharmacists doing med checks, we really should have had access to that. And now we can check their A1C, when their last A1C was, whether they're due for their A1C, their LDL, their albumin to creatinine ratio, their EGFR, and so much more. All the things we learned about in pharmacy school. And I worked as a hospital pharmacist in the UK before coming to Canada, and just remembering and recognizing how much I missed that in terms of the tools pharmacists should really have had access to. And now in Ontario anyways, community pharmacy has access to so much of that data, as our hospital colleagues have. And importantly, we're able to develop our practice and respond to this data so we can help our patients better. So I mentor so many pharmacy students, and they all agree that this fluency in interpreting lab data is one of the most important pieces of their learning and development. So yeah.
Amazing to hear. I would say that journey of sort of continuous improvement, new things, enhancements, the innovation journey, all of these things are going to continue to evolve the practice and continue to bring additional tools that we don't know exist even today. So thank you for that. Let's quickly jump in. We have a couple more minutes. And Ruth, I think there's a couple things that have queued up here. I see a question here about a local endocrinologist insists that her patients do a diabetic education course every 5 years. I think this is great. So that's a comment. Thank you for that. A great idea. Any other questions to come in for our panelist? You can use the Q&A section. Are you able to see some of these as well, Siva and Fabio, the ones coming in the Q&A?
Yeah, definitely. We see one about symptomatic testing, which we can certainly answer. It's not
there we go. Yeah.
But, what are your opinions on doing symptomatic testing in community pharmacy? So I'm not doing it right now, but I do have an opinion on it. I think Fabio's doing it, so I'll just share mine. I think if it can be done safely in community pharmacy, I think why not do it, right? Because it can make such a profound impact on a patient's life. And I think that many pharmacies are equipped to do it safely. So that's my opinion. But I also think that no pharmacist should be forced to provide that service. It should be an option. So yeah, that's what I think. What do you think, Ron?
It's a catch-22 because you are, if symptomatic patients are coming into your store, it's great for the overall community that you're testing them, but at the same time, you're putting other people at risk. So at our location, we're doing it curbside. So these patients aren't coming in the store. They have to call and make an appointment, and it's done outside because we don't want to put them next to the patient. But either way, regardless of how we feel about it, we have to find a way to allow pharmacies to do this because, as I said before, we have the accessibility, we have the training, and we have the efficiencies. Healthcare systems are looking to us for these programs and it's not going to stop with this. It's going to carry on forward. And if healthcare is going to survive with the economies that we have now, they will need pharmacies to be at the forefront.
Absolutely.
Well said, both of you. Yes, thank you for that. I think we have another comment. So as a country, we do not do enough diabetes prevention education on diet and exercise. And that's actually something that we are looking at bringing forward is a whole nutrition and diabetes signature series like this one for next year. So that's interesting. Can you put questions in Q&A, please? Oh, sorry, that's Ruth typing that. Are there any other questions before we, I'm so literal, right? I just looked and I read it. I didn't interpret before I uttered my words. Any other questions coming in here? We are just about 8 o'clock, so right on time. We'll give things a few minutes. Yeah, go ahead, Saba.
Yeah, that sort of question, comment about a local endocrinologist insisting that her diabetic patients do a course every 5 years. You know what, sorry I keep banging on about the MedsCheck thing. I really think it's a fantastic service, and I know it's at risk or whatever, but right now we have it, and I think it should be done every year because it really does benefit the patient. Even if you think your patients are doing fine, you'd be surprised what you can uncover and help them with. So just wanted to provide a comment. And there's someone with their hand up, Suha. If they can't type in, we can allow them to talk if needed. But maybe they've got their hand up for another reason.
Yeah, I didn't see that. So maybe Ruth? Thanks for that, Saba.
Oh, no problem.
Got a couple screens going here. Ruth? We've got someone with their hand up.
Yeah, she's allowed them to speak, but I think they've just got their hand up.
Did you want to type your, I think it's Suha, did you want to maybe type in the Q&A? Don't see anything coming up yet. Sometimes people hit it by accident. Happens, especially if you're on an iPhone and you might be moving your finger around the screen. So we'll just give her a second here. It's been a fantastic discussion back and forth, and I appreciate you both being leaders in the space of diabetes education. It's been great and very informative to kind of get some points of reflection and practice in terms of in your community and so forth. So thanks for that. So I don't see anything else coming in. Are there any final words from either of you in terms of, I know, Siva, you talked about the MedsCheck and lots of passion there. Any final thoughts from you, Fabio, that you want to share before we close our webinar this evening?
Just want to say this is the most intriguing time to be a pharmacist.
Agree. So I want to thank you both for your time. I want to thank BD, Jennifer, and Annika for their time and their sponsorship of this program. This has been one webinar of many. We started this journey back in, I think it was March. So we had a number of different webinars, content, blogs, and so on. So again, have a moment or take a moment rather and check out the URL that we have on inside of the chat to access all the recordings from before or any of the material or content. And just as a one more plug about our 2022 membership is open for OPA, and we look forward to your continued support. And for those who are not members, jump on, and we're doing some great things, a lot of priorities for advocacy as well as education for next year. So thank you again for joining, and we'll see you all soon. Have a good evening.
Thank you so much.